will be more aggressive and have more delinquent behaviors in childhood. They also have a higher risk of having a substance abuse problem when older. Effects on the fetal brain are permanent, and even moderate alcohol consumption in pregnancy can cause long-term difficulties, some which are not evident for several years. More health efforts are needed to educate women on the hazards of alcohol consumption during pregnancy. Unfortunately, according to the authors of Health Promotion, substance abuse programs have not addressed specific issues for pregnant women. Antioxidants may lessen the effects of prenatal alcohol exposure for those mothers unwilling or unable to give up alcohol. Pregnant women who abuse substances may face criminal charges for child abuse, which can lead to jail time or even admission to an inpatient psychiatric hospital.
Seriously, you just need to relax. Sit down, have a beer with me, and have a smoke too. You're smoking too? What are you thinking? Why? What's wrong? Just relax. It helps me relax.
According to the American Pregnancy Association, over 1,000 babies born in the U.S. die each year because their mothers smoked while pregnant. Nicotine, lead, arsenic, and carbon monoxide from cigarettes get into the baby's bloodstream through placental perfusion and reduce the amount of oxygen and nutrients the baby needs. The authors of Maternal Child Nursing Care state that smoking can cause low birth weights, miscarriages, increased risk of ectopic pregnancies, preterm labor, premature rupture of membranes, placenta previa, placenta abruption, and even fetal or infant death. Once born, infants may have difficulties in intellectual and emotional development, increased fine motor tremors, hypertonicity, decreased verbal comprehension, and congenital defects such as cleft ear, ear infections, and heart defects. Secondhand smoke is just as bad as third-hand smoke and first-hand smoke. But third-hand smoke in general, or smoke that stays on carpets or clothes, can increase the risk of SIDS in infants, according to the American Pregnancy Association. Women who are pregnant are strongly encouraged to quit, or at best, reduce the number of cigarettes they smoke each day. It helps to have support while trying to quit. According to the authors of Health Promotion, all pregnant women should be screened for tobacco use, and a pregnancy-tailored 5A behavioral counseling framework should be used. Ask about tobacco use. Advise to quit. Assess willingness to quit. Assist to quit. Arrange follow-up and support.
What on earth happened to you? Oh, I've just been really sick lately, and I'm just really tired and stuff. I think I'm getting a cold. So I just started taking all these pills, and they weren't working, so then I tried some prescription pills, and they didn't work, so then I just decided to try cocaine. Have you taken all of these? Yeah. Drugs? You mean you haven't seen your doctor yet? Well, it can't be good for my baby to have me be sick. So...
According to Pharmacology for Nurses, no prescription drug, over-the-counter medication, herbal product, or dietary supplement should be taken during pregnancy unless your doctor says the benefits outweigh the risks. Each drug has a pregnancy category assigned to it. Pregnancy category A and B drugs are believed to be okay and cause no harm to the fetus. Category C drugs are potentially harmful to the fetus, and benefits must outweigh the risks. Pregnancy category D and X are believed to cause birth defects and should be avoided by all pregnant women. Certain acne medications can cause facial abnormalities and neural tube defects. Lithium for bipolar disorder can cause heart valve malformations. Anti-seizure medications can cause intrauterine growth restriction, small head size, mental retardation, and a depressed nasal bridge. Illegal drugs such as cocaine, heroin, and methadone can cause the same effects as anti-seizure medications, as well as placenta abruption, limb abnormalities, and heart defects. Make sure to discuss all drugs with your provider before taking them. If you believe that you have become infected with the virus, also notify your provider. According to authors of Maternal Child Nursing Care, herpes virus can cause retinal dysplasia and a small head size. Rubella virus can cause cataracts, glaucoma, deafness, and congenital heart defects. Herpes varicella zoster can cause muscle atrophy and mental retardation.
I think we need to take you to the hospital. You might have broken your arm. I think so too.
Hello, ma'am. My name's Hilly. I'm going to be your nurse today. I just have some preliminary questions. Is there any chance that you could be pregnant today?
Obviously, I'm not here for my pregnancy, I'm here for my wrist.
Oh, of course, of course. Well, the reason I ask is because we're probably going to have to x-ray your arm to see if it's broken. And x-rays have ionizing radiation. According to the Center for Disease Control, prenatal radiation exposure can cause developmental risks, including height reduction, impaired brain development, mental retardation, leukemia in small children, small head size, and cancer later in life. For women who are less than 2 weeks pregnant, the greatest concern is death of the baby with x-ray exposure. The benefits of having exposure to radiation for x-rays or other diagnostic exams must outweigh the risks. It is recommended that you postpone x-ray procedures until after the birth of your baby. Tell all of your healthcare providers that you do not want x-rays while pregnant.
Wow, I didn't know any of that.
Well, we'll consult with your doctor to see if this pregnancy is more beneficial than dangerous at this stage in pregnancy. Is that okay?
Yeah. I just wish I would have known all this before I got pregnant so I could have solved my problems before.
Well, when I was pregnant, I know I attended a smoking cessation class to help me quit smoking. I also know that there are many other programs and education classes that you can take to get more education about your pregnancy.
Yeah, your friend is right. In fact, 4 to 5% of birth defects are caused by exposure to teratogens. It's also important to keep in mind that your exposed to teratogens have different effects on the fetus. For example, teratogens have the biggest effect on fetus when its cells are rapidly dividing and growing. According to maternal child nursing care, neural tube defects may occur between weeks 3 to 16, and heart defects are most common between weeks 3 and 6. Cleft lip can appear during weeks 5 to 6, and low-set, malformed ears and deafness can occur between weeks 3 to 9. Cataracts and glaucoma are caused in weeks 4 to 8. Lastly, genitalia can be affected during weeks 7 to 9.
Wow, I sure hope my baby turns out all right.